next presenter. We have joining us Dr. Jayanth Narayan, who is joining us from the University of Singapore. Welcome, welcome. I can see you. And I'm starting to see your screen, so that's working beautifully. And you're going to tell us a little bit, hopefully, about how we can counter some of this impact of COVID-19 on both our sleep and work engagement. Over to you.
Thank you, Mal. Thank you for this opportunity. And this is probably it's the second time I'm presenting these results in a public forum. And considering how close this is to when we collected the data, it just shows the accelerated nature of how we are able to produce and disseminate knowledge in these times. So I'm going to present. It's ambitious. I have 25 minutes. And I'm going to try and present two studies. Okay, so let's see how far I can get. So, so we know, we are in the midst of a pandemic, and if you look at the organizational literature, most work has looked at stress that occurs within the organization, things that happen because of workload, demands on the job, having a coworker that is abusive, or having a boss that is abusive. So you mostly look at intra-organizational stressors, right? So what we have here is an extra-organizational stressor. You have something that's coming in from the outside, and this is not the first time this has happened. Just to be clear, there are many natural disasters like earthquakes, tsunamis, terrorist attacks that tend to cause these stressors from outside the workplace that does impact people at work. But what we face today is something unprecedented. It's global, it's collective, and everyone we know is going through this. So there is a bit of an amplified effect of these stressors on people at work. And added to that, work is moved remote. People are working, if you have a job, that is. Unfortunately, that's not always true for many people in the world. So we are going through unprecedented amount of stress from outside. This is leading to a mental health crisis, and organizations obviously are going to be affected by this crisis. So it's one of the greatest challenges since the Second World War. So we know that the COVID-19 is a big source of stress for people at work. And one of the immediate causes, one of the immediate ways in which a crisis shows itself in people's lives, apart from other domains, is sleep. So sleep gets affected almost immediately. So we know that kind of an ongoing trauma leads to sleep disturbance, the financial crisis, terror attacks, natural disasters, war. All of these cause a disturbance in sleep, and sleep is one of the most important ways to build immunity. We know this from the medical literature. And it's kind of a negative cycle. So if the crisis, the stress leads to sleep disturbance, that will lead to poorer immune response. And immune response is exactly what you need to fight the virus in the first place, right? So you're getting into a negative cycle, so you don't want that. So you want to find ways to deal with the sleep problem. And also sleep has an immediate impact on people at work. We know that sleep leads to lower performance, lower work engagement, greater rude behaviors at work. So we have all kinds of downstream consequences of sleep. So among the many things we could have focused on, this seemed like the most important and the most immediately measurable variables. So we kind of went with sleep as something that we need to focus on. So the motivation here is, right, so we started this project in February, and this was just as the pandemic was coming out, and we were kind of ahead of the curve because my collaborator on this project, he's from Wuhan, and she now works in Shanghai. So even before this was a big issue for the world, in this part of the world, it was already something that people were really concerned and worried about, right? So the immediate reaction to this was, could we do something to help? Is there any intervention that has an evidence base that we can use to help people overcome the negative effects of COVID stress? So the motivation here was, can we help employees at work neutralize the effects of COVID-19 stress on sleep? And can this downstream benefits, can this have downstream benefits for employees working remotely? These are the two questions that we motivated. So why does a trauma or a extra organizational stressor cause a sleep disturbance? So there are kind of two reasons for why. There's kind of an immediate reason, and there's a metacognitive reason. So the thoughts about the trauma impair your sleep, and then you are beginning to think about the fact that your sleep is being impaired. So it's thoughts about the thoughts that lead to a secondary arousal, and that leads you to a vicious cycle of insomnia, right? Like, so your sleep gets depressed, not disturbed, not only because of the immediate stressor, but your thought about the stressor causing the primary arousal. So, and this is the perfect kind of situation where mindfulness can help, because we know from now 2 to 3 decades of research that mindfulness is a metacognitive process that fixes both the primary and the secondary arousal. So what is mindfulness? So mindfulness is now become quite, I started working on mindfulness research 15 years ago, and it wasn't as cool to do this, but now it's become very prevalent, prominent. We know lots of research in clinical and social psychology that looks at the beneficial effects of mindfulness. So mindfulness is defined as a non-judgmental awareness and acceptance of the present moment, right? So and there is a state component to mindfulness. There is a trait component to mindfulness. So it's one of those traits that you can cultivate, rather an ability that you can cultivate. So it's often associated with a meditative practice, but that's not the only way to cultivate mindfulness. Among the many ways you can cultivate mindfulness, meditation is one of them. I almost don't like the term mindfulness. Attention and awareness captures this better than the word mindfulness, but for whatever reason, this label has stuck, and we will go with the label. So essentially, it is an ability to stay in the moment, where you can dissociate yourselves from thoughts about the past and thoughts about the future, and you can observe and accept ruminative thoughts. So when you are going through a trauma, a stressful experience, you often have repetitive ruminative thoughts where you don't know how to press the stop button of these thoughts. You almost wish like you could just say stop, and these thoughts would stop, but there's really no way to do this. And one clever way to circumvent this process, which is, you try to use your willpower to stop the thought. And we know from research in psychology that the more you try to suppress a thought, the more hyper accessible it becomes. So a much better way to overcome ruminative thoughts is to turn your attention to something else, like the breath, for example, or bodily sensations. There are various ways where you can bring about a mindful awareness of the present. And we used breathing practice, but you could use other methodologies as well. So the moment you take your attention to the breath, which is in the present moment, you can't breathe in your past or in the future, you are able to arrest this pattern of ruminative thinking and ruminating about the ruminative thinking. So if I go back to the previous slide, what mindfulness does is it really attends to both the primary arousal and the secondary arousal, thereby bringing about a state of calm, a state of presence that can help you with overcoming your sleep disturbance. So that's really the very simple hypothesis that we had, that mindfulness will neutralize the negative effect of COVID-19 stress by helping you sleep better. And this in turn, the fact that you could sleep better would also lead to better work engagement, because you are sleeping better, you're well rested, and that leads to more resources at your disposal for you to be able to engage with your work. That's really the two simple hypotheses that we had. So the first study we did was in Wuhan. So if you look at those dates here, they were before the world was waking up to this pandemic. So this is in February 2020. So we started discussing the study middle of February, and we got quick IRB approvals from my co-author's institution. And so she is from Wuhan. So she managed to recruit participants from her networks in Wuhan. And we pre-screen participants. So mindfulness does have, you need to make sure that people are not in any kind of clinical symptoms. They don't have any clinical symptoms. So because it can actually make it worse, make the symptoms worse. So we only recruited participants who were not displaying any kind of clinical depression or any of these other. So we had a pre-screening, and once we had participants recruited, we got their consent. We got them to finish a baseline survey on the 20th of February, where we measured some trait qualities like trait mindfulness and trait anxiety. And then for a period of 10 days, from the 21st of February to the 1st of March, participants engaged in one of two practices. So they either engaged in a mindfulness practice, which is, anchor your attention and experience in the present moment. And this was delivered in Chinese, which was the local language of the participants, or they were in the mind wandering condition, which is they could think of whatever they want. So they engaged in the same practice. So participants were either in the mindfulness or the mind wandering condition, to ensure that, because we expected positive effects of mindfulness, we also followed up with our mind wandering participants to have a mindfulness intervention after the 10 days of the study. So all of them were recruited to be a part of the mindfulness practice after the study concluded, just to make sure that everyone is treated ethically, because this is an intervention and we are in the midst of a pandemic. We want to be able to help as many people as possible, right? So they did the study in the morning, and in the evening they reported their daily anxiety. They also reported their sleep and their caffeine intake in the morning, the caffeine intake of the previous day. And on the last day, there was no practice. They only reported their sleep and their caffeine intake of the previous day. And we debriefed the participants. We told them what the study was about, and we continued to keep them in a mindfulness practice. And many, many of them, in fact, I think some of the mindfulness practices went on for almost a month. People continued to be in the study because they found it quite beneficial. Participants were paid about 100 RMB, which is about 14 US dollars, and the WeChat group continued the daily mindfulness practice, right? So let's look at some of the measures. So trait mindfulness. So this is the Brown and Ryan 15-item measure. So sample item is I rush through activities without being really attentive to them. This is a trait measure. I'll come to the intervention itself. So trait anxiety. This was measured on first day. I worry too much about something that doesn't really matter. So it's a measure of anxiety. Now, in this study, we measured the stress from COVID-19 using objective data. So in the next study, I'll report how we measured it with subjective data. But in this study, we used the daily increase in daily rates of COVID-19 in the region, in Wuhan, because that was a primary source of stress. So participants were checking the news, checking the numbers. Today, those numbers are not as stressful because there is a global measure, there's a local measure, and people may not be paying as much attention to those numbers now. But when this was unfolding in Wuhan back in February, this was a primary source of stress for our participants. Sleep quantity was measured by how many hours they actually slept last night. We also measured sleep quality, and I'll come to a little bit in how what sleep quality did. How do you evaluate your last night's sleep? Was the sleep quality measure on a scale of 1 to 7. Daily caffeine intake, because caffeine is known to affect sleep quality and quantity, so we had to control for caffeine intake. Okay. So what we found is that the intervention itself did not have an impact on sleep quantity or quality per se. Direct effect did not have a direct effect, but it had like a moderating effect. So this is a busy set of numbers, but I'll show it to you visually. This graph kind of summarizes our results from our first study. So essentially what we find is that participants in the mind wandering condition essentially showed a decline in their sleep. I mean, not a the slope is there for you to see. So the mind wandering condition, they actually, and one would have expected in a control condition as well. There was a decline in sleep quantity, but if you looked at participants in the mindfulness condition, their sleep quantity remained somewhat flat. So that difference between this point here and this point here is not significant, but but the slope is significant. So participants in the mindfulness condition did not, suffer from a decline in sleep quantity, but participants in the mind wandering condition did, right? So what it shows is that it seems like mindfulness somewhat neutralizes the impact of stress on sleep quantity. Okay, so that's kind of, so we did some robustness checks. We looked at sleep from the previous day, looked at whether sleep quality had an impact, and none of that. Okay, so we have 5 more minutes. So the next study, so we wanted to replicate these results with another sample. So this is a study we just finished. We finished this end of June, and I have the results, but I don't have the tables nicely formatted. But I'll share with the results with you straight away. So here we recruited a sample of 140 working adults from the UK on the Prolific platform. And we didn't have an intervention in this study. We measured mindfulness, daily mindfulness. We also had a measure of daily work engagement. With our first sample, we really could not measure any kind of work variables because most of them were not working at that time, even though they were employees, they were simply locked down. It was such a shock that employers had not put in any mechanisms in place to work remotely. But by June, we did have all of those measures. And we conducted this study for 10 consecutive days where we measured mindfulness. So every morning they measured mindfulness. So and we had a subjective measure of COVID stress. So we said today at work, how often did COVID-19 interfere with your job or career? That's one sample item. Every morning we measured their mindfulness state. We measured their sleep quantity from the previous day. And we also measured their work engagement. So today at work, I felt bursting with energy was one of the measures of work engagement. And what did we find? So we replicated the neutralizing effect of mindfulness. So on days that employees were mindful, they reported actually sleeping more. And that in turn, on days when they had slept better the previous night, they also reported better daily work engagement. And this is a within person study. So we have we have 10 days of measures. So this is accounting for effects of the person. So we have 140 times 10, so 1,400 data points. But the analysis is a multi-level analysis with within person effect, right? So what are some of the contributions of this work? So mindfulness is an effective intervention here. So as we are going through the pandemic, we would like some solutions to how do we handle the mental health crisis that is going to hit us. So mindfulness seems to be a way to do this, and it's a pretty cost-effective, quick way. There are many different ways to deliver a mindfulness practice. So we are right now in the process of seeing whether we could do a large-scale intervention with large numbers of people across the US, using the mindfulness as a practice where we could help them cope with the mental health pandemic. It has an impact on sleep quantity and also has an impact on work outcomes, work engagement. So there are many ways we can cope with the pandemic. There are policies you can implement, but here is a cost-effective way to deliver a large-scale behavioral intervention where you could see some immediate benefits in helping people cope with this. So these are my collaborators. So Michelle was my collaborator on the Wuhan study. She's at CEIBS in Shanghai. Theo is a doctoral student at SMU. Jingxian is a formal doctoral student at NUS who's going to go to Católica in Lisbon when he gets his visas done. Izen is a PhD student at NUS, and Noriko was a PhD student at NUS who's now a postdoc at SMU. So thank you so much for this opportunity, Mal. I'd love to take questions and have a dialogue.
Well, first of all, thank you to you, Jay. I think you've given us all food for thought, and I think in a nutshell, I think the point you're making is that it's so easy, isn't it? Really, I'd like to make a couple of first of all tie a couple of threads together as usual. The one is obviously that you are sort of singing the same tune we have heard over the last few days, that number one, there's a connection between physical health and mental health, but the other is that almost as a yin to the yang of the talk we had by Micah Allen, which was about interoception, which was, in his view, a consequence of the pandemic, that we're hearing all of this news about physical illness, and so we become more physically aware of our own bodies. You're suggesting that one way to cope with, and in fact cure, some of the impact of the pandemic is to become more interoceptively aware. I mean, to become aware of our breath. And I find there to be a potential conflict in there, that we are metacognitively more aware of our bodies. Or, we have a little headache and we all of a sudden think, am I feeling feverish? Am I? And yet you're saying ruminating about the various things that are stressing us is not the way to go, but ruminating perhaps over, maybe lower level things like just our breath might be the way forward. But maybe you have something to say about that first.
Yeah, thank you. That's a great question, right? So I think the beauty of the mindfulness practice is that it is a deliberate attention. So when you have interoceptive awareness, that's a complicated word, but you perhaps are having a set of random cognitions about the body, right? Like you are probably wondering, hey, I'm having some respiratory difficulties here today. So you're having a lot of secondary appraisals as well of the primary appraisal. So yes, you're having some respiratory difficulty, but you're also immediately kind of wondering, ruminating, could this be COVID? Could this be, this neighbor sneezed on me? So you have all of those second order appraisals, and that's causing, and those are outside your control because you don't know what's going on, and that sense of lack of control can induce stress. What happens with mindfulness? It's a very deliberate kind of attention to your mind body complex, right? So you are bringing your attention to the mind in a special way by focusing on the breath or by focusing on sensations, and that kind of deliberate attention is giving you a sense of control, because you are doing this very deliberately. And of course, initially the practice can be challenging. We know that, because you once you begin to pay attention, you start to realize, oh my God, I can't keep my attention on the breath even for a few seconds. But very quickly, over the course of 10 days, you quickly begin to get that pattern. So most participants in our study were very happy to be a part of the study. They in fact were like, is the study over? Can this go on for a few more days? And they were also quite bored, with nothing to do in lockdown. So this was for them, they also had some community, all of that was going on. But even over and above that, they had there's something in the day that they could control, which is they could come to their breath, focus their attention, and get inside themselves. So there is this deliberate quality to your attention when it comes to mindfulness. And it can seem boring initially, but it is so interesting, because the vistas of the mind that open up when you bring your attention to the moment, you see a depth quality to your attention. You see, and that's of course, much further along in the practice. I've been practicing for 24 years, so there is this sense of stillness and depth you see once you get deeper and deeper into the practice. But even when you're in a fight or flight kind of a situation, very stressful, pandemic roaring all around you, just taking your attention to something which you can control can help you find that stillness within you.
So I find, you didn't need to sell me. I think it's fabulous. And I think that it's, whether it's embedded in meditation or in prayer practice, cultures have gone to practices of mindfulness in various shapes and forms throughout our history. I did want to mention that Rachel Sumner has asked a question, which I think you've basically already answered. She said, this is very interesting work. Did you capture how easy or acceptable participants found the intervention? Some find it very hard, but from what you're saying, they really, really enjoyed it. And as a sort of addition to that, Gerrit Pfuhl, another one of our speakers, has said, important for us too, we offer a mindfulness self-help app with metacognitive training. So perhaps you guys can get together at some point to talk about, yours being very much on the empirical side of things, but also doing good and the development of these apps. I myself, of course, have jumped on the bandwagon and with a host of wonderful collaborators, including Domina Banaku, one of the other chairs, are creating a touch and mindfulness app.
Wow.
So we can maybe also talk about that, perhaps a topic for one of our workshops.
Absolutely, would love that. That's the whole idea of coming out and speaking in a forum like this, so that we find like-minded collaborators.
Absolutely. So maybe we can add that to our list, and I will be in touch, obviously. Yeah, I just see that time is running, but I do have time for one last question, which is that I found it. Did you have data on? So you said in study one that sleep didn't, the total number of hours didn't increase, but that it didn't decrease as it did in the other cohort.
Yes.
And in
Yes.
study two, that sleep hours increased. So you do, not only does it stabilize, but it increases. But did you actually also quantify perceived stress, which, you know, maybe they're not getting more sleep in study one, but they're still feeling the protective impact of the mindfulness?
Right. Yes, we do have results on anxiety, daily anxiety. I think I can't be quite sure now. So many studies going on, so I have to go back and check what the effect was. But what was really surprising in general as a pattern was the effect was not a main effect of mindfulness. It was more a neutralizing or a buffering effect. So it seems like the salubrious effect of mindfulness got activated when there was a stressor in the environment, particularly, right? The more you felt that, the more salubrious the effect of mindfulness was. And this is consistent with many other studies that have shown that I mean, sometimes people do get main effects, and we would have been very happy to get main effects, but we didn't. And we replicated the not getting the main effects in study two as well. So it seems to be something around mindfulness kind of kicking in its salubrious effects when the stress is perceived, rather than as some kind of a blanket positive effect. So obviously, I like to see main effects, but it's not there in both.
I'm going to give you some homework, Jay. So my inkling is that to become more mindful of the body, breath is one thing, but touch may be the other. And in lots of meditative practices, whether it's yoga or indeed prayer with rosaries, there's usually a tactile component. You activate the body in a very targeted way. And it's maybe you only will get these main effects when you activate the body. But we have to stop there. So that's your homework. We can talk about this hopefully more in a workshop. I thank you so much for your time, for your input, and we will move